Hi, everyone, and happy Martin Luther King Day. I'm not sure how you are spending the holiday, but I am here at Honeycomb Clinic feeling very blessed to be in our new clinic location, which will be opening very soon. So, hope to see you in the office. But I'm here today to speak to you about cervical cancer. If you are not aware, January is Cervical Health Awareness Month, and it is a cancer that is very common, caused often by HPV. More than around, not more than, around 80% of women will contract HPV in their lifetime. And you may think, wow, that's such a high number. How is that possible? Well, partly because, unlike many other STDs, condoms do not always protect you from HPV. So you may be doing the right thing, using protection, talking to your partner, getting checked. Hi, Dr. Nix. And you can still contract HPV. Many people are unaware, and it's challenging because unlike HIV, herpes, hepatitis, syphilis, gonorrhea, chlamydia, where we get a little blood or a urine sample and tell you if you have it, women usually don't find out they have HPV until they get their annual Pap smear. And their partner, if male, may not know that they have it at all. The reason being, there are different strains of HPV. Some strains cause genital warts. If you have a wart, you see it. That's how you know that you have genital warts caused by HPV. It's a different strain, usually, that causes the cervical cancer. So your partner may have that strain, have no warts, then pass HPV on to you, and not right away, but many years later, sometimes decades later, after this could be someone you had sex with in college or after college, and now you have moved on from that relationship, met the man or woman of your dreams, and not knowing that you have this virus, pass it on to them, and years later, they have cancer. It's crazy, right? And not only does HPV affect women, and cervical cancer, it can also cause other things like throat lesions, throat cancer. But today we're here to talk about cervical cancer. So, with that being said, sharing some statistics that I have pulled up right here from the National Cervical Cancer Coalition. 14,000 women in the United States are diagnosed with invasive, right? So invasive means it's not just on the surface, it's not just local, but it's gone deeper. Cervical cancer each year. Another fact that I found very interesting, sometimes it takes us a while to catch up with the data. I know it's 2022, but this article in 2016, 4,000 women died from cervical cancer. So how do we prevent this? How do we protect ourselves? So one, have that conversation with your partner, about getting STD screening, making sure that you're aware of the history. If they've had genital warts or any other type of HPV they're aware of, let them know. Second, get your Pap smears done. I meet a lot of women, young women, old women, educated women, who are really doing boss things in their lives every day, but haven't gotten a Pap smear. And at some points in my life, that has been me because I've been so busy. Oh, I'll get it done next year. I'll get it done next year. I'll get it done next year. And before you know it, 3 years have passed. The amount of time that you need your Pap smear done, like time between Pap smears, varies based on your risk level. The younger you are in general, the more often you will need a Pap smear. So if you're 21, sexually active, multiple partners, no judgment, you probably need a Pap smear every year. If you're over 30, married, one partner, you may need a Pap smear every 3 years. This is a conversation that you have to have with your doctor. Sometimes it may even be every 5 years. So talk to your doctor, see how often you need a Pap smear, and make sure you're getting your Pap smear done according to that schedule. Men, talk to your wives or your partners, talk to your mom, your aunt. Don't assume that the people you care about in your life are automatically doing the things that they need to do to take care of themselves. Sometimes we have to take care of each other. So there's a lot of talk about vaccines, right? Everyone's talking about the COVID vaccine. But don't forget, HPV is a vaccine that you can start giving to young kids starting 11 and 12. And a lot of parents, when I would offer it, would say, oh, my child's not sexually active. Exactly. Just like you wear a seatbelt to prevent a car accident, you should give your children the HPV vaccine before they become sexually active, so that they will not they will be at lower risk for having this problem and later on potentially getting cancer. So that being said, I highly encourage everyone to make sure that you're getting your HPV vaccine, getting your Pap smear, getting screened as much as you can. If you need a doctor that can do your Pap smear in the Houston area, come and see me. I do offer well woman exams, and there are plenty of directories out there if you're not in my area to help you find a doctor who can offer you the appropriate screening and vaccination. So please just stay safe out there, ladies and gentlemen. I just want to clarify, although the HPV vaccine is helping to decrease the risk of cervical cancer in women, both men and women can get HPV, and young boys should also be vaccinated for HPV. And that's all I have to say about this topic. In the comments, if you watch this video, please let me know what city you are in, and if there are any topics that you would like to see me talk about next. Thanks for tuning in, guys. Tisha Rowe, family medicine physician, founder of Honeycomb and Rodox. Have an amazing MLK Day.